The other dosage form category is the liquid dosage forms, and they are just liquids, and basically they are useful for children, even elderly patients, and also individuals with swallowing problem. In the earlier series, we've talked about solid dosage forms, and one of the problem you usually notice with tablets and capsules, and I've talked also the challenge in swallowing when I talk on capsules is, people with swallowing problem will have difficulty to swallow basically tablets and capsules. So liquid dosage forms could be a better option. So what are the different liquid dosage forms we have in the market? There are liquids like solutions. You can have a bit flavored or sweet preparations referred as syrups. We also have suspensions, those ones which you are advised to shake well before use. We also have emulsions, also as the solution or liquid dosage form. We also have hydroalcoholic preparations referred as elixirs. In the next video, I'll talk about each of these liquid dosage forms. Please stay tuned. When we started the dosage form discussion, I talked this important point, and I said dosage forms or formulations of different drugs are made from two important things: active ingredient and an additive. Remember the example of the meat stew. The meat and the other flavors. The same is true with dosage forms. Dosage forms have an active ingredient that will cure the illness and other additives like the flavorant to give you a good flavor, maybe sweetening agent to make it a bit tasty so that to mask a bitter taste. Some drugs are also, you'll find disintegrants to help tablets to chop down, to break down easily in the stomach. Some tablets might be very smaller in size, so in tablet preparation, maybe additional bulking agent will be added so that at least the bulkiness of the tablet will increase to a reasonable size, okay? We have quite hundreds of different additives in a dosage form. The mixture of this active ingredient and the additive will make your dosage form a palatable, okay to take, and stable formulation. Look, preservatives. You can check some of the labels of your medicine you have. Some liquid formulations have preservatives to ensure that they can stay for some time. So in any dosage form, remember we have two things: active ingredient and the additives. Mixed together, they will give us a good dosage form. So we have quite a number of solutions in the market, from cough syrups, we have vitamin drops, we have eye drops, drops, we have IV fluids. All these are referred as solutions. They are clear. You see, there is no need to shake the bottle or to shake the syrup before you swallow them, unlike suspensions, okay? That is why solutions are quite convenient to be given even as an injectable. That is why most of your injectable preparations could be solutions. Yes, suspensions can also be given, but in this discussion we'll talk about solutions. So solutions don't need shaking, okay? And solutions really deliver the medicine evenly and also quickly and without really hindrance. For example, when you are given an IV fluid, you see all IV fluids are clear solutions. So you'll also find solutions being very clear in the bottle. So here is the home take message for those people who will be prescribed your solutions, be it an eye drop, an e-drop, or maybe you're buying an IV fluid for a patient who's been treated in hospital. As I said, solutions are clear. So if you find anything that is sedimenting or any thread moving in your solution preparation, that could be a quality problem, because solutions have no problem of sedimentation. That is why we don't need to shake them. They need to be clear. If you are taking an eye drop and if you see something is, in the bottle, maybe something funny is running up and down in your eye or e-drop preparation, now that is a poor quality medicine. Or if you have an IV fluid The same, you don't expect any particle to be seen in IV fluid. Solutions are clear preparations, and you don't need to shake them. That is the important point. If you have ever been told to shake a bottle before use, to shake your medicine bottles, that is a suspension. Suspensions are liquid dosage forms, and they will have two ingredients. One is an insoluble solid, which is in a liquid. You see, for you to see a clear solution like a clear liquid like that of solution, the solid and the liquid should be completely soluble. Take, for example, salt and water. They are 100% soluble. You see, so if you mix a salt and water, there is no sedimentation, you will see. But however, in suspension preparations, the solid ingredient is added as an active ingredient or as an additive in making suspensions. They don't dissolve completely in the liquid or in the liquid medium. So what is the characteristic feature of suspensions? When you keep them, you will see something has settled down. That is called sedimentation. That is why you are advised to shake before use. And remember, that shake is not for your body. It's not about shaking your body. It is shaking the bottle. The bottle should be shaked before use. That is very important. And the reason we shake the medicine bottle before taking is to evenly distribute the active ingredient. In the earlier video, when I talk of solution, I said they are evenly distributed. You can take them as is, immediate, you see, but you don't achieve this one in suspensions. So in suspensions, you need really to shake the bottle before taking. That is why suspension preparations, when they are given by injection, they are not given intravenously or directly to the vein. They are usually given directly to the muscle so that they slowly get access to the blood. We'll talk about that in detail when we talk on routes of administration series of videos. The other liquid dosage forms are syrups. What makes syrups different from solutions and suspensions are syrups have a bit of sweetness or sugary thing. Meaning now you can see that syrups may be good for pediatric preparations like cough syrups. However, diabetic patients should be a bit careful when taking syrups because of that sugary nature in syrups. If you are on insulin and you're type 1 diabetic patient or type 2, you should be watching out for your blood glucose level and consult your doctor before taking any of the cough syrups, because cough syrups have sugar or have a sucrose that made the product to be sweet. And there is a reason behind that medicine being sweet. Either that medicine is meant for children or it's meant to mask maybe a bitter or unpleasant, unpalatable taste of the medicine. Are you in any of the syrups? Are you taking syrups at home? Please drop that name of the syrup you are taking in the chat and then or in the comment section, and we can talk about it. See you in the next video.